Winter is here, and that means the gray, cold, and snowy weather for us here in northern Michigan, which makes us particularly susceptible to seasonal affective disorder, also known as SAD, S-A-D. There are ways to cope. Eric sits down with Dr. Shafer to talk about the ways we can create and find joy during these dark and cold months.
Well, the gray clouds are rolling in. The cold weather is settling in. It's getting time for winter. And with winter, every single year comes seasonal affective disorder, also known as SAD. And this can really play a large role in making people feel depressed this time of year. We have Dr. Shafer back on the show to help us navigate this. So, Dr. Shafer, what is some advice that you would offer for someone that's starting to feel a little down now that the sun's not out so much?
Well, I think, Eric, thank you so much for creating this space to have this discussion, because it's important to understand that living in Michigan and northern Michigan, we are at very high risk. You know, when you look at the population across the country, we're talking 3% risk of SAD or seasonal affective disorder. Here in northern Michigan, it is 40%, and we are second only in the United States to Alaska. So it's a big and a common issue. And so just having the awareness is really important. But the good thing is that there are things we can do that are really effective that don't always involve taking a medication. I know some people really are hesitant towards that, although it can be an important part of treatment for depression, which we know that SAD is a subcategory of depression. So some people do need medication to help them through that as they're having disruptions in serotonin levels in the brain. But for 50 to 80% of people, it's actually adequate and quickly relieving to just have really high intensity fluorescent light at your eye level for 20 to 60 minutes a day, depending upon the person.
Oh, okay. Now, how can we go about achieving that? Because that's a pretty large amount of time that you need to spend in front of the light.
Yeah, exactly. And so I think, one way we could is when we take a look at how much time we are maybe checking emails or even doing our makeup in the morning. For someone like me that does makeup, there are little places in our routine where we can make sure that we're getting a nice dose of light. You can just put the light up. The important thing is that it's at your eye level and that it's really bright. Unfortunately, just putting on the lights in your room that are those nice, soft, glowy lights, those aren't going to do the job. It's also really important, though, to understand what your circadian rhythm is so that you can get the optimal reaction from the treatment with the light. And you can actually go to cet.org and do a questionnaire there. And it's a really helpful way to find out what your circadian rhythm is for your lifestyle so that you know when the light therapy will be the most effective for you.
Gotcha. So in addition to light therapy and in severe cases, medication, is there anything else we can do? Particularly, I'm thinking, is it good to, even in bad weather, try your best to get outside and at least get some fresh air, even if the sun's not shining through?
Absolutely. What we do the first 30 minutes of our day is really important for not only setting our intention mindset wise, but just setting our circadian rhythm. So getting outside, avoiding your phone, avoiding that source of light, but actually going outside, getting the fresh air, getting the sunlight on your face when the sun's out is really, really important. It's also important to make sure you're getting adequate exercise as directed by your doctor, depending upon if you have any other health reasons why you need to be cautious about that. And also making sure that you do have a good sleep routine. We don't want that to go out the window just because it's dark earlier and dark later. We want to try to get adequate amounts of rest at a predictable time because that will set us up for the most success.
Perfect. Now, in our last minute or so together today, Dr. Shafer, are there any other tips or tricks that you would offer the viewers at home?
Diet is really important. We know that having a healthy diet is important for regulating our body and our brain health. And when we think about seasonal affective disorder, especially up here in northern Michigan, where we're not getting the sunlight on our skin, vitamin deficiencies can also be driving this problem, or at least contributing to it. So making sure with your doctor's assistance that you aren't deficient in things like vitamin D or vitamin B can be a helpful part of making sure that you are optimizing your health and minimizing your risk for seasonal affective disorder.
Well, Dr. Shafer, thank you so much for taking the time to sit down with us today and giving us the information we need to combat seasonal affective disorder, also known as SAD. Dr. Shafer, where can people go online for more information or to get information about your podcast, Talks with Dr. Shafer?
Well, absolutely. If you want to learn more about me and my podcast, you can go to drshaferstedronova.com. And if you want to learn more from a respected mental health website, you can go to namimi.org, which is the Michigan NAMI website, to learn more about SAD as well.
Perfect. And of course, we're going to make sure all the links you need. It's all going to be available after the show today on 9and10news.com.